immigrants in recent years, Astoria and Jackson Heights.
That's WNYC's Arun Venugopal reporting.
WNYC is supported by FX's Alien Earth, starring Sidney Chandler, Timothy Oliphant, and Babu Cisse. Emmy Award eligible. Alien Earth is now streaming on Hulu and Hulu on Disney Plus for bundle subscribers.
On the next Fresh Air, actor Josh O'Connor. He won an Emmy playing a young Prince Charles in The Crown. Now he's the lead in Steven Spielberg's new film Disclosure Day. We'll talk about his approach in this new blockbuster and Spielberg's decades-long exploration of the idea that aliens are among us. Join us.
Weekdays at 2 on WNYC.
And as we were driving away from our apartment and it was getting smaller and smaller, I was wondering, where will I be at the end of the summer? Would I be free? Would I be dead or back in East Germany?
Join us for stories of near misses, great escapes, and the people that hold your hand through it all. That's on the Moth Radio Hour from PRX.
Tonight at 9 on WNYC.
Marketplace Morning Report is coming up next, and then in 10 minutes at 9 o'clock, it's the BBC NewsHour on WNYC. Let's check in with London and see what they're working on. Hello, London.
Good morning, WNYC. I'm Sean Lay on NewsHour. How a drone rescued US pilots downed by Iran, and Marin Alsop on conducting the 7 Dreams of Gaudi on the centenary of the architect's death. That's BBC NewsHour coming up at 9 on WNYC.
Low 70s with some clouds now, a slight chance of afternoon showers and thunderstorms. Some sunshine, a high temperature near 80 with a light wind. Then tomorrow, a 50-50 chance of afternoon showers and storms. Sunshine with a heat advisory. It's going to be hot, high near 91, but feeling close to 100. We'll have to be really careful. Hot again Friday, hot again Saturday and Sunday.
Energy costs are driving inflation and changing our energy choices.
Marketplace Morning Report is supported by GEP, working to help companies optimize value and reduce risk with the AI-native GEP Quantum Intelligence Procurement and Supply Chain Platform.
From Marketplace, I'm Kimberly Adams. We just received fresh data this morning that reveals how prices for consumer goods changed in May. They were up 0.5% from April and up 4.2% from this time last year, pretty much what economists were expecting and the highest we've seen in 3 years. Strip out the always fluctuating food and energy prices, and month-over-month inflation is up 0.2%. But before taking them out, the Bureau of Labor Statistics says rising energy costs account for more than 60% of the monthly price increases, which is probably no surprise to anyone who's bought gas lately. The war in Iran is, of course, the major factor at play there. Oil prices spiked overnight after the U.S. launched military strikes on Iran in retaliation for the downing of an American helicopter near the Strait of Hormuz. But as prices fluctuate, solar power use in the U.S. is hitting new milestones. Marketplace's Nancy Marshall-Genzer has more on that.
Solar is the leading source of the new power being added to the U.S. electricity grid, according to the Solar Energy Industries Association. In a new report out today, the association says solar and energy storage accounted for about 90% of new grid capacity in the first 3 months of this year. And Associated Press analysis says that in May, for the first time, the U.S. got more of its power from solar than from coal, with 12.8% coming from solar and 12.2% from coal. That's despite President Trump's efforts to boost coal. The Solar Energy Industries Association says 74% of all solar capacity installed in the U.S. in the first quarter of this year was in states won by President Trump in 2024. I'm Nancy Marshall-Genzer for Marketplace.
Let's do the numbers. Dow, S&P, and NASDAQ futures are down in the 5 to 0.7% range, with the Dow future down 231 points. The 10-year Treasury yield is also down at 4.52%. And since we were talking about energy and the war earlier, the price of a barrel of West Texas Intermediate crude is at $89.13 a barrel. And the average price of a gallon of gas in the U.S. right now is $4.15. This time last year, it was $3.12.
Marketplace Morning Report is supported by Schwab. At Schwab, investors get choices ranging from self-directed investing to full-service wealth management all in one place. Learn more at schwab.com. And by Bitwarden, designed to strengthen online security for businesses with a password manager built to secure logins across all accounts and devices. Bitwarden.com.
We started our series on rural health care this week with a visit to a shuttered hospital in Thomasville, Alabama, a community of about 3,500 people an hour and a half north of Mobile. We've been looking into how policy choices at the federal level can affect healthcare choices available at the community level. But as we were talking to folks, there was one issue in particular that kept coming up.
Is our low reimbursement. They are extraordinarily low.
Our reimbursement rate for insurance is a lot less.
They can get a job there and make so much more money because they have such a better reimbursement rate.
In Alabama, we got the lowest reimbursement rate in the nation. The lowest in the nation.
That last voice was Sheldon Day, mayor of Thomasville.
If you look at the demographics of Brunswick, Georgia, and you look at the demographics of Thomasville, very, very similar. Isolated rural areas. Brunswick, Georgia gets 90 cents on the dollar reimbursement. We get 65.
Why is that?
I'm glad you asked that question because that's the question I keep asking. Why is the formula slanted that badly? 30 years ago, pretty much every hospital in our region were delivering babies. Now there are zero. Zero. And in my opinion, a lot of the costs have escalated because of the way we reimburse from a national level.
Hospital insurance reimbursement is very technical, and we're not going to get too deep into the details. But the simple version is that for older Americans on Medicare, the federal government decides how much it will pay for medical services based on essentially wages in a given area. Wages are pretty low in Alabama compared to elsewhere in the country, so the Medicare reimbursement rates are relatively low as well. Liz Walker is Executive Director for Telemedicine and Rural Initiatives at the University of South Alabama Health System in Mobile.
And it's almost like kind of the origin story of then how your commercial rates are set off your Medicare rates. So when you start with a low number, everything progresses from there.
Private insurance, Medicaid, the Children's Health Insurance Program, and the low reimbursement rates in Alabama shape how much doctors and nurses get paid and how much money hospitals and clinics can make. Walker says one reason it's so hard to fix this system is that it's effectively a zero-sum game.
It's a set amount of money that the federal government is going to put towards this number. If our wage index goes up, someone else's is going down.
We met Dr. Marsha Rollerson, a pediatrician of more than 40 years in Bruton, Alabama, an hour and a half from Mobile. Over a lunch of catfish, grits, and fried green tomatoes, she expressed similar frustrations about the low reimbursement rates.
It has to do with some formula that I don't understand at all, that has to do with the makeup of your state, but it doesn't make sense anymore.
So what are the solutions? There is money set aside for rural hospitals in the big tax and spending law President Trump signed last year, and Alabama is getting just over $200 million. But it's not going to boost the rates or even shore up the operating costs for rural hospitals.
I don't want to disparage it, but it's pie in the sky. Did anyone talk about how important it is that we get paid fairly from Medicare patients? Did anyone talk about the fact that so many people don't have insurance and don't come in until they're really, really sick? Is there anything in this document that's going to change that? Those are our problems.
Rollerson is talking there about Alabama's plan for that new Rural Health Transformation Program. States across the country are waiting on next steps from the federal government to get that money flowing. We'll have more on this and other potential solutions for the rural healthcare crisis in the rest of our reporting from Alabama this week. I'm Kimberly Adams with the Marketplace Morning Report. From APM, American Public Media.